If you grind your teeth, or your dentist told you you needed a night guard, or you clench your teeth where you get a headache, then this video is right for you because I'm going to show you how I fix teeth grinding, teeth clenching in my office predictably using orthodontic treatment. So let's go. Hey guys, this is Dr. Robert Passamano. I'm a board certified orthodontist. Today we're going to be talking about teeth grinding, teeth clenching, how to fix those issues with orthodontic treatment that is predictable. So what is teeth grinding? Teeth grinding is when the teeth are touching and sliding past each other in a rubbing motion. Enamel is lost as a result of the friction, and sometimes you go to the next layer, which is the dentin layer. And in this photo, you can see the dentin layer, which is the darker brown layer. And in there, you can also see a little bit of the root canal. So we don't want to have teeth grinding because it wears away the teeth and you have less teeth, and we don't want that. And the other term is teeth clenching. So teeth clenching is when the teeth are together, but they are not rubbing against each other. The muscles are activated, meaning that the jaw muscles are trying to move, but they can't move. And so that usually causes muscle soreness and headaches. And that is what we're going to be talking about mostly today. Here's some signs of teeth clenching. Number one is going to be mandibular and palatal tori. Tori is an exostosis of bone growth, meaning that when you clench your teeth are together with no rubbing motion, you are creating excess pressure on your teeth, and therefore the bone is going to grow in size to withstand that extra pressure you're putting on the teeth. This is not malignant, it's benign, meaning it's not like it's a cancer. It is your bone is growing because you are clenching your teeth. You could see them usually on the tongue side, on the lower. They come in little bumps sometimes. Sometimes they are huge, like this one over here. Sometimes they look like this. Sometimes they're on the palatal tori right in the middle. That is the number one way that I can tell that you are a clencher. Number two is you have excess wear of the teeth. Sometimes you have fractured teeth, like if your dentist says, hey, you're fracturing your teeth, your tooth is broken, you're grinding so much, then maybe you are clenching. A lot of clenchers also have tension headaches. That's going to be on the sides of the head, usually in the morning. They usually have excessive anterior bite. I'm going to show you a bite map in just a second. And they may or may not have clicking or popping. So sometimes they have clicking, sometimes they don't. So I don't really use clicking and popping as a sign of a clencher. It's usually going to be tori, heavy anterior contacts, and then the headaches are usually a sign of clenching. This is a digital bite map showing where the patient contacts. The red contact is going to be the heaviest. Orange is going to be a normal contact. Blue, green, and yellow are going to be lighter contacts. This patient has a palatal tori as well as a mandibular tori on both sides. This is a sign that the patient is a clencher. She is a 34-year-old woman. And so what we're looking to do is to decrease the heavy contact on the front teeth. So that way we can avoid the clenching and the grinding and the wear of the teeth. This will also help with the muscle soreness. This is a 62-year-old female with heavy anterior contacts. You can see the mandibular tori. They look a little bit different. So sometimes I see it like this. Sometimes I see them more diffuse and larger. But either way, this is a clenching patient. Somebody that's clenching usually has muscle soreness. Sometimes they have the headaches. Here's a 54-year-old woman who has heavy anterior contacts as well. We can see that there is grinding on this upper right lateral incisor. The tooth is actually being worn down. There are mandibular tori on the left and the right. These are more diffuse and larger. This patient also clenches their teeth, and the goal is the same thing, to increase the horizontal overlap of the teeth so that way we don't have any heavy red or orange contact on those front teeth. Here's a 28-year-old male with heavy anterior contacts, large mandibular tori on both sides. Same thing, the goal is to decrease the anterior contacts so that way these tori don't increase in size. Here's my last example patient. We have a 25-year-old female that finished their orthodontic treatment. You can see the bonded permanent retainer wire on the bottom. She has very large mandibular tori for her age. Usually tori this size are reserved for older patients. So this patient needs to redo their orthodontic treatment to correct the deep bite, to reduce the contact on those front teeth, or else these mandibular tori are going to increase in size. This is not what I like to see. This is not my patient. I did not do the orthodontic treatment, but we are going to go ahead and fix this for her and give her a better bite. Let's go through a patient example showing how we can reduce the heavy contact on the front teeth to prevent clenching, muscle soreness, morning headaches, And this is exactly what we're looking to do. On the left side, we are seeing heavy anterior contacts. That's the red and orange color. On the right side, after 3 months of Invisalign, you can see there's no more red contacts, no more orange contacts. The patient is symptom-free. This is exactly what we're looking to do. This patient actually only did lower treatment, so we moved the lower teeth backwards. So we'll look over the simulation right now. Here's the digital simulation of this patient's teeth. We did lower only treatment. The goal was to increase the horizontal overlap to decrease the front teeth contact. From the lower view, you can see that the initial position has a lot of heavy red contacts. And as we progress through the treatment, we are transferring the heavy bite from the front teeth to the back teeth. This will allow for more freedom of movement of the lower jaw. That results in less muscle soreness and headaches. That is the ultimate goal for these patients, is to increase the horizontal overlap, decrease the heavy contact on the front teeth, and therefore this patient is super happy with the result and no more jaw pain and no more muscle pain. Thank you guys for watching the How to Fix Clenching with Orthodontic Treatment Predictably video. Hopefully you found it useful. If you are someone that has a clenching issue, muscle soreness, morning headaches, then hopefully this is the information you need to fix your issue. Orthodontic treatment is a great option for people like this. Don't forget to check out my other Invisalign videos. Don't forget to like and subscribe, and I'll see you on the next one.